It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
And hi again, everyone. Jim Knox along with Dr. Nina, and welcome to another episode of Top Docs of Houston, the show that, of course, features some of the best doctors and procedures in the Houston area. And Dr. Nina, we're going to kick off the show with one doctor that has helped one individual lose a lot of weight.
Yes, he's one of the top bariatric surgeons in the Houston area. It's Dr. Robert Marvin.
The difference with the sleeve compared to the gastric bypass is that there's no malabsorptive component to the surgery. It avoids some of the long-term issues that can happen with the gastric bypass. In particular, there are very few vitamin and mineral deficiencies later because everything goes down the normal way. The gold standard operation, of course, is the gastric bypass. It's been around for 50 years. It has very predictable weight loss. What we're seeing is patients who are a year out from surgery who've lost 60, 70, or 80% of their extra body weight.
Well, I had what's called the Roux-en-Y, is where they make a small pouch out of the stomach and they divert part of the intestines so that I have a little bit of malabsorption. So I have to supplement my diet with several vitamins that would otherwise not be absorbed through part of the intestines.
Jean had gone and had a lap band operation done previously with another surgeon. And like some of the lap band patients, what she'd experienced was a frustrating cycle of having the band adjusted to a certain tightness and getting some difficult symptoms from that, only to have it loosened to make those symptoms go away, and then losing a little bit of weight and then gaining it back. And she has lost somewhere in the neighborhood of 2/3 of her extra body weight from the level she was at with the gastric bypass. 2/3 of the weight has gone away.
My friends comment that I have more pep in my step and I'm able to work more days in a row and longer hours and not feel fatigue.
I looked at the breakdown for the last 12 months and it appears that about 74% of the patients are choosing the laparoscopic sleeve gastrectomy. Most of the rest of the patients are choosing a gastric bypass. And we're doing very few lap bands currently, mostly because the weight loss just isn't as predictable with the lap bands and there are some long-term issues.
Go to the seminars, especially Dr. Marvin, who is very open, explains things in a very simple way for everyone to understand. We have numerous support groups here in Houston, and that has been my main success.
Well, minimally invasive surgery, first of all, is very difficult to define. Nobody has a real definition of what does it really mean. Generally, there is smaller incisions compared to traditional techniques. There is less pain associated with that procedure postoperatively. Usually, one hallmark of it is a quicker recovery.
I had severe leg pain and lower back pain. I'd been to several different doctors and saw different orthopedic doctors, and of course ran the gamut with medications and all conservative treatments, and this is over the course of 5 years.
Typical patient that comes in looking for surgery with us have usually had physical therapy for at least one time of 6 weeks or longer. They've typically had symptoms for 6 months or longer.
I'm a busy person. I'm still fairly young, and I didn't want to take a year out of my life to recover. That's what really attracted me to Dr. Siddiqi.
What happens when they first come in is they get evaluated. We take a full history. We find out about their story, how long they've had symptoms, exactly what are their symptoms.
I actually had 2 different procedures done. One was the XLIF, which is fusing the L4 to the L5. The other procedure I had done was fusing the S1 to the L5. He went in through the side and removed the disc, and the second procedure was 1 week later. He went in the back and put in the hardware and the post from the S1 to the L5.
Rhonda is about 6 months following surgery now. She's taking little or no pain medications. She's walking around normally. She's had her physical therapy. She's able to return to a lot of the activities which she previously could not do.
It's hard to explain how I feel now compared to how I felt then. When you deal with long-term pain, and pretty much there was no hope for me. Once I started doing my own research and found Dr. Siddiqi, that was my ray of hope out there. I'm living proof that this procedure works.
Officer Wayne Schultz weighed an unhealthy 554 pounds until he met Dr. Robert Marvin. To find out more on Wayne's story and other life-changing stories, log on to topdocsofhouston.com.
I've been having a problem with like cystic type acne for a few years, and came in to see Dr. Perri about it.
The acne cysts are more of a deeper lesion. It's a lot of inflammation, it's red, it's tender, it has a lot of symptoms to it. Those respond really well to a steroid injection, a very dilute amount of steroid into the base of the lesion and the surrounding area.
He said, you know, the cystic acne is more like hormonal, which I did notice that that did definitely correlate. And he started me on a good regimen of antibiotic and a hormone receptor blocker.
And Melissa's on a really good maintenance regimen of spironolactone, which is a hormone receptor blocker. It does not affect the hormone levels at all. It just prevents the hormones from actually getting into the skin receptors that cause those deep acne cysts from happening. However, you occasionally get some breakthrough acne cysts that develop, and then anytime she has those cysts develop, she can come in and we can do a very small injection into them to get her some instantaneous relief. But she's on kind of a long-term maintenance of the spironolactone medicine. She's also on an antibiotic called doxycycline, which controls the inflammation of acne too.
The plan that Dr. Perri has fit for me, I'll be on the antibiotic, but once I've got good control, then Dr. Perri said that, you know, we'll stop the antibiotic and we'll just continue on with the spironolactone.
There's a really easy treatment, and they can be gone within a day. So if you have like a big event, you can come in and have the injection done. It's almost minimal pain. Sometimes people describe it as just a mild pinch, where others don't even feel the pain because it's such a small needle. And then the steroid gets around the inflammation of the cyst, gets that inflammation back to the bloodstream, out of the skin, and a lot of patients describe it as almost like magic because it just, within a day, it's gone.
I feel like it's definitely greatly improved since I've been on the regimen of everything. And whenever I do, you know, get a flare-up, I can always come in and he injects a little bit of a steroid in it, and by the next day, it's gone.
Let's talk about that yucky thing, nausea, vomiting, and diarrhea. How do you know if it's food poisoning or not? Well, food poisoning usually occurs suddenly, and it usually occurs with vomiting and diarrhea at the same time. Very tough situation. Usually goes away in a day. If your symptoms last more than a day, then you probably should see your doctor because that's not consistent with food poisoning, and it may be something more serious. Dehydration is the main problem with food poisoning or the intestinal flu. How do you know if you're dehydrated? Well, your mouth will be dry, your urine output will be very low, and you'll probably get dizzy when you stand up because your blood pressure goes down when you're dehydrated. What's the best way to fix this and prevent dehydration? Well, you can get over-the-counter anti-diarrhea medicine and anti-nausea medicine. Sports drinks are wonderful because they have lots of sodium and potassium, which needs to be replaced. The main thing to do is rest, let your stomach rest for 8 hours without putting any fluids in it, and then start with clear liquids like water and ice chips, working up to the sports drinks later.
I was really scared, not knowing if it would ever happen for us, and it was starting to become a sensitivity. You know, we tell people all the time, I'm not shy to say we used fertility to help us out, because I feel like people should not be scared or afraid or embarrassed.
It was clear that Melina and Jeremy wanted to try something less invasive than doing IVF.
What I noticed right off the bat with Dr. Witz is he would call me every day. We did a test, we did anything. I would get a phone call that night from his personal cell or from the office from him.
And when I talk about otherwise unexplained infertility, what we mean is that of the three things that are typically associated with fertility, ovulation, sperm count, and or sperm production and fallopian tubes, there wasn't anything that we could identify. And we did controlled ovarian hyperstimulation and did insemination, and my recollection is she got pregnant on the first cycle, and she was very happy about that. And did very well.
It worked, and we got through a couple of scares, and he was really on top of it. And instead of having quadruplets or sextuplets, I have one, which I was really happy about because one was more than enough to handle. But Gabriel's been a blessing. Ever since he was born, he has blessed Jeremy and I's life in more ways than I can imagine. A lot of people have said that to me, you know. It was great from the get-go. Everything was so warm and informed, and I never felt left in the dark, or that I was just a number, or that I was a paycheck. You know what I mean? I felt like a person.
No, I think that the most rewarding thing is the patients who it's not been easy for, that come back and they're successful. That probably means the most.
He brings us a lot of joy, and we're a much healthier family and marriage and everything. It's been great. Can't wait to have a second.
Okay, now for more life-changing stories about some of the procedures you've seen on our show, please visit our website, topdocsofhouston.com.
Topdocsofhouston.com, the place to go to find the right doctor as well as the latest procedures. Right now, Dr. Nina, the place to go is our next top doctor, one of the best plastic surgeons in the Houston area. Here he is, Dr. Rivela.
Here at Rivela Plastic Surgery, we perform plastic and reconstructive surgery. We emphasize aesthetic procedures, primarily of the breast, body, and face.
I was predisposed to like a droopy jawline, and so that began to be my focus when I looked at myself in the mirror.
Cheryl came to me with the concerns about her, again, the jowling area and deep lines on her face. She's a yoga instructor, and in particular the Bikram type of yoga where it's very hot, and I think she perspires a lot and is very thin, and she noticed her skin sagging. So to help her with that, we did what we call a mini facelift.
I talked to the staff first and then had a consultation with Dr. Rivela, and he recommended doing a mini lift. I felt like I was ready to do that, and you know, just with some guidance and the questions that I asked and the way they were answered, I felt like it was a comfortable procedure for me to move forward with.
In general, most of the patients are women that come for a facelift. They're in their early to mid-50s. They have the signs of some jowls and what we call marionette lines. Those are lines that go down on each corner of the mouth. They have some wrinkled skin on their neck, and so that would be probably the ideal patient.
I'm only 3 weeks out of my surgery. I feel like, you know, I'm really happy with the results.
Well, it's a good feeling to know that she now feels more confident, and she's of course smiling and very happy with the results, so of course I feel good about it.
I feel like that with the advice and the treatment and the service that I get at Rivela Plastic Surgery, I'm able to really maintain a level of confidence that allows me to get in front of people, and you know, most of the time with no makeup on, and I feel really good about myself.
Pretty much allergies has been pretty much since I was born. And then I guess it really came in more in focus when I was diagnosed with asthma when I was 2 years old. And because my asthma is allergy triggered. And basically it's been pretty much a full battle since then.
In the case of asthma, what you have is an inflammation that takes place inside the lung. And this is a normal lung here, which is nice and pink and open. And when a person has an asthma attack, they have a muscle that just actually contracts, and it causes all of the inflammatory cells to come in, and the mucous membranes get very thickened, and over time they can actually become fibrotic and they're scarred. But the real important thing to notice is how red and angry it is compared to the other side.
You know, as a kid, back then, I just didn't have the knowledge or understanding of what was happening. It's just I knew it's like if I gone outside, did things, any activity, it's like my allergies start kicking in, then which then caused my asthma to trigger. I would really hinder my activity as a kid.
But I actually came into Kenny's life in 1997. He was 13 years old, and he weighed 285 pounds. And he was homeschooled, I believe, shortly thereafter because he was sick so much with his asthma that he couldn't go to school.
Yeah, between the asthma and allergies, I mean, everything was just haywire. I mean, it's like literally we're trying different combinations of meds every few months because just trying to find that right combination, and finally found that right combo, and it's been pretty good so far.
We got him well controlled, and now we're trying to put him on allergy shots so that we can eventually get him off the Xolair. And hopefully, with the weight loss and everything else, he will be on very little medication.
Especially with Dr. Dickens, I mean, she sits down, she takes, walks you through everything. She takes, time. She doesn't rush you through, or you're not just a number. I mean, she really gets to know you, gets to know your history, and just that personal one-on-one that I don't see with other doctors.
What we want to do is try to help a woman get through this time frame with the intense symptomatology.
According to Dr. Meredith Morgan, intervention and management needs to be tailored to the level of severity.
For mild hot flashes, home remedy self-management techniques are effective. For some women, yoga will work. Other women, strenuous exercise. On average, you can't say that either one of them really works for everybody, but if it's good enough for an individual woman, it's good enough, and that's all she needs. There is a technique of breathing that's derived from transcendental meditation that actually has been studied quite a bit and found to be quite effective. There are two sets of data on the research, and there are different sets of outcomes and benefits and hazards involved in using hormones. In general, we try to start with a low dose and let the patient titrate up to a level that will produce a circulating estrogen level that's satisfactory for her response.
Now there are concerns with hormone therapy. What Dr. Morgan would like to point out is that there are three major concerns against the others.
First, breast cancer. Everybody's concerned about breast cancer. Second is heart attacks. That's serious. But the most common one that we really address all the time is estrogen. And there's been very little historical interest. Your question was, what are we doing now as opposed to 10 years ago? We really haven't changed much in our concept about blood clots. For that reason, our preference is to try to use the non-pill forms of estrogen as much as possible. The pills go through the liver, and simply put, can increase blood clotting chemicals and the risk of blood clotting.
Now the most common question for most women for Dr. Morgan is, how will I know what I'm going to be confronted with? Well, the good news, according to Dr. Meredith Morgan, is that menopause is controllable.
Basic message I'd like you to get is there are many ways to approach this. This is not going to be incapacitating. It's controllable. Maybe that control is the goal, but we're not going to have terminal hot flashes.
A bunion informity is a deviation of the first metatarsal and the second metatarsal. So basically, what people see of their big toe is this. So the big toe is pointing this way, and this bone is going out this way. When it's not matching up well, you get bone growth. And so bone starts to build up right here, and it also starts to build up top.
I spend about 85% of my time traveling, so I'm in and out of the airports. As a training manager, I do a lot of facilitation, so I'm on my feet a lot walking, and it got to the point where even flat shoes, what most people would think is comfortable shoes, became painful.
Her surgery was an awesome bunionectomy, but it was a little bit different because on the x-ray I discovered that she had severely arthritic joint. She had fracture fragments. So these fracture fragments never healed, and because they were constantly moving, it was severe pain. It caused an enormous amount of bone growth on the top and on the side. So I was really excited to do her surgery because I knew it would provide immediate relief.
I'll be wearing the boot for at least another 4 weeks, and then I'll come back for another reassessment. And then he'll determine then whether I can take the boot off and then just start walking in normal shoes.
People always ask, why do I have this problem? And the biggest component is genetics. So if you look at your parents' feet or your grandparents' feet, it's basically telling you, if you see a bunion deformity, that your chances are your feet are going to develop these structural deformities. Then, obviously, for the females, it's wearing the high heels. There's a price to pay for high fashion. You wear the high heel, it puts your foot in position, which predisposes you to a bunion deformity.
I would love to be able to get back out there and be pain-free. A lot of times, I couldn't wait for the day to end because I would be in so much pain. So I'm looking forward to being able to be on my feet for longer period of times pain-free.
The look on the patient's face when they come in and they see the results and they're happy with the results, and they see that instead of having a crooked toe, or that it's actually straight, and that the pain that they had before is gone. So, that's the rewarding part to me.
Kimberly was born with a facial birth defect until she met Dr. Michael Eisemann. Now she's a beautiful young girl. To find out more on Kimberly's story and other life-changing stories, log on to topdocsofhouston.com.
The ideal patients for dental implants are ones that have been through lots of restorative procedures, and where these procedures that just aren't predictable. And so we were able to give them their third set of teeth with the use of dental implants.
I had an accident when I was 10 years old, and I fell down on my face and I dislocated my jaw. And I didn't know that then, but I started looking for the oldest doctor or the one with 35 years or more of experience. So I went to the facility on Gessner and I saw Dr. Metz, and they said, this is the guy who's gonna have to be working on you. I had to decide if I wanted to go through with it, and I did research. He graduated top in the class.
So in Tico, we were able to move his upper jaw forward and set his lower jaw back so as to help line up his skeleton so that his teeth meshed together well. We, as specialists in oral surgery, are uniquely qualified to provide these procedures.
I just figured out this is the best facility, this is the best doctor, and I truly believe that, Dr. Metz and his team, they know what they're doing.
These patients, when they come down the hallway, when we see them after this procedure, we see their level of confidence has gone up tremendously. We can tell by the smile on their face as well as their dress. They're dressed sharply and they're holding their chin up. You can certainly tell that they are happier individuals afterwards. Technology today has really revolutionized how we practice implant dentistry. We have cone beam CTs, which allow us to take a CT of the patient in the office, and in about 20 seconds we have 360 degrees of bone around the implant. So we know ahead of time whether we need to graft, and also the type of grafting that we need to do ahead of time. So patients are better prepared for the experience and know more of what to expect afterwards. We're able to do this in a safer fashion. And it's much more rapid. The procedures are much more rapid, and the recovery is much easier as well.
We hear when you're a kid in school and all talking about having good hygiene and keeping your body clean and this sort of thing. It is very important. Most people don't realize that there are a lot of very dangerous microorganisms out there. There are things like staph, there are viruses, or all sorts of things. We hear stuff on the news about the avian flu and all these sort of things. And if you don't use good hygiene, you don't keep your hands clean, if you take your hands, touch your nose, your eyes, your mouth, those are ways that you can transmit diseases to your body. And there are some organisms out there that just by being in certain situations you can be exposed to, like this very dangerous methicillin-resistant Staph aureus, the MRSA that a lot of people have heard of. That can really be a very dangerous bacterium. And we're finding more and more of these cases are acquired in the community. Years ago they were only in the hospital, but now we see a lot of people just getting them just in general. So there are a lot of things like that that can cause problems that people don't understand where you can actually acquire one of these infections. For that reason, it's very important that people do keep their skin clean, that they do wash their hands relatively frequently or use one of the hand cleansers, and especially if they are a carrier of something like staph, to use some kind of measure to keep their body from developing a boil or one of these more dangerous infections. And so as a consequence, after you've been in that environment, you really ought to use some kind of a measure to sort of sterilize your skin, so to speak, and make sure that you take either a shower or wash your hands or something at the very least to make sure that you're not going to actually be colonized with one of these organisms that can lead to a more serious problem. One of the ways that we're kind of excited about is that we've developed this new bleach-containing wash. Bleach is very strong antiseptic product. It actually kills just about any bacterium, kills a lot of other things like viruses and even fungi. And if you use something like this, it will cleanse your body quite well, and if you use it on a periodic basis, you can maintain your body from actually getting colonized and keep it sterile or keep it cleaner for a longer period of time. So we recommend using something like that or one of the antibacterial soaps or something to keep your skin from getting one of these serious infections.
Graham was swimming in a banana boat with 2 other people. 2 of them fell off the banana boat, and Graham sustained a fracture of his cheekbone when someone's knee struck him in the cheek.
He immediately could tell that something was the matter, and luckily he's an orthopedic surgeon, so he pulled me out, felt my cheekbone, and he's like, "You have a broken zygomatic complex." I'm like, okay. So I really don't know what a broken zygomatic complex means, but I know that if it doesn't feel right, and when I put my hand on my cheek, there's no cheekbone anymore. If I got it taken care of within 7 days, then it shouldn't be an issue of where I got it taken care of. And he recommended that instead of getting it taken care of out in the middle of nowhere, 3 hours north of Atlanta on the weekend, that maybe I should wait to come to Houston and find a doctor who's good and make sure they'll have more time. It's not that pressing.
He saw me with a depressed cheekbone, some double vision and numbness of the cheek, and there was a palpable and visible deformity. He had a significant number of injuries and fractures, and he had no support to the floor of his orbit. So with time, if that's not corrected, the eyeball will drop, he'll have increased double vision, and he will have continued numbness of the cheek. Now the fracture was right through the opening. There's a foramen or opening in the cheekbone where the nerve supplies sensation to the teeth and the upper lip and the cheek, and the fracture went right through that area. Often by reducing the fracture and placing the bones where they ought to be, there's less compression on the nerve, and the nerve regenerates, and there's nearly normal sensation afterwards. But that's about the only residual that he has really right now.
So apparently if I caught the knee a little bit closer to my nose, I could have died. And if I didn't get the surgery, then I probably wouldn't have an eye, because since there's no bone holding it in place, it would have just sunk into my face, and that would have caused a whole bunch of damage to the eye to the point where I couldn't use it. So I think having a second eye is pretty awesome. I like that, and the fact that you really can't tell is pretty unexpected bonus for me. I was kind of thinking, oh cool, I'm gonna look like some weird, gruesome Frankenstein Quasimodo type situation, and you really can't tell the difference.
All right, that's going to do it for this edition of Top Docs of Houston. Now don't forget, you can visit our website to learn about life-changing stories or some of our doctors at topdocsofhouston.com.
That is the place to go to find the right doctor and, of course, the latest procedures. And a reminder, if you have a question or comment for us, please send us an email at info@topdocsofhouston.com. That's info@topdocsofhouston.com. So long, everyone. We'll see you next week.